In this podcast episode, the guest, Dr. Jolene Brighton, discusses various myths and misconceptions surrounding the female body. She addresses topics such as the orgasm gap, clitoral health, hormones, and overall women's wellness. Dr. Brighton starts by debunking the myth that women orgasm less frequently than men. She explains that the orgasm gap exists due to a lack of education and understanding about the clitoris. She emphasizes that the clitoris and the penis are made of the same tissues and that both require stimulation for orgasm. Dr. Brighton encourages open communication between partners to ensure mutual pleasure and satisfaction. She also highlights the importance of understanding the role of insulin sensitivity in women's sexual health. Dr. Brighton explains that insulin sensitivity can impact the clitoris, leading to decreased sensitivity and potential pain during sexual activity. She emphasizes the need for education and awareness about the clitoris and its role in sexual pleasure. Moving on to women's health, Dr. Brighton discusses the role of adrenal glands and their impact on overall well-being. She explains that the adrenal glands release hormones such as cortisol, aldosterone, and DHEA, which play a crucial role in regulating stress, blood pressure, and hormone production. She mentions that chronic stress can lead to adrenal dysregulation and fatigue. Dr. Brighton provides tips for supporting adrenal health, including managing stress through practices like meditation and deep breathing. She also emphasizes the importance of nutrition, particularly consuming foods rich in vitamin C, vitamin B5, and fiber. Additionally, she suggests maintaining stable blood sugar levels throughout the day to support adrenal function. The conversation then shifts to the topic of progesterone. Dr. Brighton explains that progesterone is a hormone produced by the ovaries and plays a vital role in the menstrual cycle and overall well-being. She highlights the importance of progesterone for anxiety regulation, brain health, and cardiovascular and bone health. Dr. Brighton mentions that progesterone levels decline with age, and hormone replacement therapy may be considered to support hormonal balance during perimenopause and menopause. Regarding testosterone replacement therapy, Dr. Brighton acknowledges that testosterone levels also decline with age in both men and women. She emphasizes the importance of addressing hormonal imbalances and their impact on brain health, cardiovascular health, and overall quality of life. Dr. Brighton suggests starting hormone replacement therapy closer to menopause and perimenopause to prevent potential health issues. The conversation continues with a discussion about hormone replacement therapy, HRT. Dr. Brighton explains that HRT is often misunderstood and that many recommendations are based on outdated research. She emphasizes the importance of understanding the individual needs of each patient and tailoring treatment accordingly. Dr. Brighton believes that HRT can have numerous benefits, such as preventing dementia, maintaining a strong pelvic floor, and reducing urinary incontinence and vaginal dryness. The conversation then shifts to the topic of the birth control pill. Dr. Brighton acknowledges that the pill has a necessary place in women's health, particularly for pregnancy prevention. However, she cautions against using the pill as a solution for symptoms without investigating the underlying causes. She also highlights the importance of tracking one's own data and being aware of any changes or side effects experienced while on the pill. The discussion then delves into the impact of the pill on mental health. Dr. Brighton explains that while the pill may not directly cause mental health issues, it can affect mood and emotions in some individuals. She encourages women to track their data and listen to their own experiences rather than dismissing their concerns. The conversation also touches on the pineal gland and its role in regulating melatonin and the circadian rhythm. Dr. Brighton emphasizes the importance of quality sleep and recommends avoiding electronic devices before bed to optimize melatonin production. Finally, the podcast explores the topic of the thyroid gland. Dr. Brighton explains that the thyroid gland affects every system in the body and that thyroid hormone is essential for overall health. She discusses the different types of thyroid conditions, such as hypothyroidism and Hashimoto's thyroiditis, and emphasizes the importance of thorough testing to understand the underlying causes. Thanks for watching. If you enjoyed the video, make sure to like and subscribe.